In terms of the overall numbers, 66,000 have tested positive, 9,500 people are currently hospitalized, 2,000 ICU patients, 4,000 patients are discharged. 1,200 is up from 965 deaths. Total hospitalized, we're still looking for a pattern on these cases that are coming in. We're still looking for a pattern in the data. The number goes up, the number goes down. There's no doubt that the number is still increasing. There's also no doubt that the rate has slowed. We had a doubling of cases every 2 days, then a doubling every 3 days, then a doubling every 4 days, then every 5. We now have a doubling of cases every 6 days. The daily intubation rate is way up. Again, sometimes it's just an anomaly. There's no clear pattern, as you can see from those past several nights. Discharge rate, again, that by and large is going up. There are only 2 operations that we need to perform. First, the public has to be responsible. Stay at home. When I issued the stay-at-home order, it wasn't, it would be nice if you did. It is a mandate. Stay at home. If you're a non-essential worker, stay at home. If you leave the house, you're exposing yourself to danger. If you leave the house, you're exposing others to danger. You can get infected, go home and infect whoever is at home. So stay at home. I know the isolation can be boring and oppressive. It is better than the alternative. Life is options, right? Stay at home. That is the best option. If you are out, no proximity, 6 feet distancing. Still in New York City, you have too many places with too much density. And I have said that New York City is trying to reduce the density in those playgrounds. Thus far, they have not been successful. If that continues, we'll take a mandatory action to close down playgrounds. Mission 2, and this is going to be more and more clear as we go on. The frontline battle is in the healthcare system. Don't let the hospital system get overwhelmed. The soldiers in this fight are our healthcare professionals. We need to recruit more healthcare workers. We need to share healthcare professionals within this state and within this country. As governor of New York, I am asking healthcare professionals across the country, if you don't have a healthcare crisis in your community, please come help us in New York now. We will return the favor. New York, yes, we have it now intensely. There will be a curve. New York at one point will be on the other side of the curve. And then there will be an intense issue somewhere else in the nation. And the New York way is to be helpful. We need supplies desperately, and we're working on that. We just had a very good meeting where we discussed supplies. I want to thank Michael Evans from Alibaba, who's here with us today. I want to thank Elizabeth Jennings from the Asia Society, who's here with us today. Who are helping us source supplies, because we're in a situation where you have 50 states all competing for supplies. The federal government is now also competing for supplies. Private hospitals are also competing for supplies. So we have created a situation where you literally have hundreds of entities looking to buy the same exact materials, basically from the same place, which is China, ironically enough. And we're fighting amongst ourselves. We're competing amongst ourselves. We're driving the prices up. When we started buying ventilators, they were under $20,000. The ventilators are now over $50,000 if you can find them. We just had a great meeting where we brought the healthcare system from across the state of New York together to come up with one coordinated plan. not private hospitals and public hospitals, not New York City hospitals and Long Island hospitals and Westchester hospitals and upstate hospitals, not big hospitals and small hospitals. The entire healthcare system, convened, coordinated, working as one for the first time in decades. The president commented on a poll that said people were pleased with my leadership. And I thank him for that. That was a compliment. As far as the president's comment about having a political contest with me, I am not engaging the president in politics. My only goal is to engage the president in partnership. This is no time for politics. And, lead by example. I'm not going to get into a political dispute with the president. I'm not going to rise to the bait of a political challenge. I'm not running for president. I was never running for president. I said from day one I wasn't running for president. I'm not running for president now. I'm not playing politics. I just want partnership to deal with this. And I said to the president quite clearly, look, when you do good things for my state and you're a good partner, I will be the first one to say you're a good partner. And I have. I went to the ship Comfort today. I said, thank you, Mr. President. We opened up this Javits Center. I said, thank you to the Army. They did a great job here, the Army Corps of Engineers. When you help my state, I'll say thank you. If I believe that New York is not being served, the federal legislation that they passed, I will say that too. Sometimes it's simple. Just tell the truth, right? And that's where we are. Tell the truth. It's not because I'm unwilling to tangle, but because I think it's inappropriate, and I think it's counterproductive, and I think it's anti-American. Forget the politics. Forget the politics. We have a national crisis. We are at war.